hospital stay should bring healing, not more illness. But at Gauteng's public hospitals, thousands of patients are picking up serious infections after they're admitted.
Well, the department themselves admit that there's staff shortages and staff have to sometimes cut corners, but they also talk about shortage of basic things like soap and not enough laundry, and these are all sources of infection that could actually be prevented.
Charlotte Maxeke Academic Hospital is the worst affected. 1 in every 10 patients admitted there last year picked up an infection.
It doesn't help that you've got one infection control nurse at a hospital as big as Charlotte Maxeke, where you've got patients in their thousands and need to expect that one person to deal with it. So that department should be adequately staffed, and then in the different facilities as well. Experts
believe the numbers are higher than reported.
I think these numbers are underreported. Poor infrastructure, not enough ICU beds, not enough infection and prevention control measurements, not enough water. You know, if you don't have proper water in a hospital, you cannot expect that hospital to have low infection rates. Then the poor reporting of these cases plays a role, overworking and over-exhausted healthcare workers.
The Gauteng Health Department says a dedicated infection prevention and control committee has been established. It will oversee the implementation of infection control guidelines across healthcare facilities.
We have developed infection control assessment tools which are used on a daily basis. Our institutions are inundated, are overwhelmed with the number of patients. We are doing the best we can to make sure that we support the people on the ground at operational level as much as we can.
But for frontline doctors, it's not enough.
If we do not fix the issue of management, where we find that we're sending people who are not really qualified for those, who are just deployed as cadres, to those areas, we don't believe that it is going to solve the problem. A problem of management and the problem of staffing, we do have to solve that issue as soon as we can.
For patients already fighting for their lives, a trip to a Gauteng hospital could mean a new battle. Experts are warning that while hospital infections are a reality, the province's rates are unacceptably high. Nabeelah Shaikh, Johannesburg.